Hello, everyone. My name is Mia Sandor, and I work at the Center of Excellence, Migration and Health at the Regional Council of Skåne. And I will give a presentation on the determinants of health. Okay, so the scope of the presentation is that I will give you an introduction to the determinants of health. So we'll look at what are they. We'll also look at how does experiencing migration impact on health, or how may it impact on health? And also, how does that migration experience interplay with these determinants of health? So that is what we'll look at today. Let's start by looking at health. Now, health has different definitions, and it may mean different things to different people. However, I think we can all agree on that we all want to be healthy and well. Now, we don't have the same conditions or opportunity to be as healthy and well as we need to or wish to. We know that there exists many differences in health outcomes, health status, when we compare groups. And these are generally known as health inequalities. And some of these inequalities are due to health inequities. And we'll look into what these mean in the next slide. So what are health inequalities and what are health inequities? Let's start by looking at what does health inequality mean. Now, health inequality is a term we use to display differences in health status between individuals and groups. If we were to look at an example, we can use life expectancy. And now, life expectancy is a common measurement of health in a population. It could be a country or a group. And we use that to look at the differences in life expectancy between different groups or between different countries. And hence, we can see health inequalities when we see a difference in life expectancy. One example of a difference we know is there's lower life expectancy among lower educated groups compared to higher educated groups. Hence, we see health inequality in life expectancy between these two groups. What about health inequity? Now, health inequity is the unfair or unjust distribution of resources that cause these health inequalities, and they are usually avoidable, the health inequalities. So again, looking at the example of life expectancy, an example of underlying or root causes of this health inequality would be socioeconomic status. And our socioeconomic status affect the conditions in which we live, work, and prosper. And our socioeconomic status is in turn determined by distribution of resources and power. For example, access to education, access to healthcare, and broader economic and social policies in a country or region. And we see that the lower an individual's socioeconomic position is, the higher the risk of poor health. So we see a clear relationship here. And this is also known as the social gradient in health. That is, if we climb up the gradient, we still see the difference in health depending on the socioeconomic position. And the social gradient in health is practically common in all countries. We will look more into these health inequities by exploring and understanding the determinants of health. So what do we mean by determinants of health? A determinant of health is a factor or characteristic that we see bring about a change in health. Now this can be for either better or for worse. And these determinants, there are many, and they have a complex interplay between biological, lifestyle, socioeconomic, societal, and environmental aspects. So one way of looking at the determinants of health is by illustrating them in different levels or layers, as you see in the model in front of you. And this is a classic model that was developed by Dahlgren and Whitehead. And here we can see that these different layers show different characteristics of determinants, but they all interact in one way or another. So here we see many of the determinants of health. Now, the examples you see in each level are just examples, so there's plenty more. Over the years, we've focused on the social determinants of health, as we've known that they become more and more important as knowledge about how social and structural factors affect health has increased. Historically, we focused a lot on individual risk factors such as smoking, physical activity, stress, etc. And although we know that many of these lifestyle factors may decrease the risk of several diseases, we can't focus simply on them without acknowledging the greater context in which individuals' lives takes place. And social determinants, they're simply the social and environmental conditions in which we're born, we grow, we live, we work, and age. And these conditions are, of course, in turn shaped by factors such as economic policies and systems, and decision-making and politics in general. And as I mentioned previously, we don't have the same possibilities of obtaining and maintaining good health, and many of the reasons why can be found in these social determinants of health. We know, for example, that the least well-off and the least educated are less likely to be in good health and have higher risk of dying prematurely than those who face more favorable socioeconomic circumstances. Now, how does migration interplay with all of this? Migration may both be seen as the result of these factors and can result in changes in each of these areas. For example, having experienced migration, one's position in society may change and your living and working conditions may change. Let's look at how migration may impact health. And one way of looking at that is by looking at the migration process, or the three stages of migration, to understand how migration may impact on health. It is important to always remember that migrants are not a homogenic group. They differ in many ways. And the only thing we actually can be really sure they have in common is that they have actually experienced migration. Maybe you yourself or someone you know may have experienced migration. The impact of migration on health depends on many factors. Reasons for migration is one. The conditions in your home country is another. And reasons for migration vary and may be voluntarily or involuntarily. However, we know that all migration leads to stress of some sort. If we look at the first stage or phase, this is pre-migration. And pre-migration constitutes all of the factors impacting on life in the country of origin. And obviously, this phase differs greatly depending on reasons for migration. But it also differs depending on what country or region you're from, what your socioeconomic position was, that is, your living and working conditions, access to education, healthcare, etc. And if you or I were to migrate tomorrow, everything we've experienced so far, everything that has shaped our lives, that will constitute as being part of our pre-migration. If the reasons for migration have been involuntarily, you may be escaping from war or conflict or persecution, and you may have been exposed to or witnessed acts of violence, torture, or more. You've seen your hometown being destroyed. You may also have had to make difficult decisions, such as leaving family and loved ones behind, or being separated as you were escaping. And the second phase, that is the migration, that is the actual migration or movement, varies also, of course, depending on the reasons for migration. If it's voluntary migration, the journey may be somewhat unproblematic. You get on a short flight and you're there. But for many, the migration phase is very unsafe, and it's the time where you have to take big risks in order to get to your intended destination. At the moment, there's no legal route to get to the EU to seek asylum, for example. So you yourself need to make your way into the country in which you aim to seek asylum by undertaking dangerous and unsafe routes, usually in the hands of smugglers. Families may lose each other on the way, probably having limited access to food and sanitation, very likely no access to medication or health care of any kind. And we know it's not uncommon to be exposed to violence or sexual abuse, exploitation, or other forms of brutality. Even towards children, we know that this is common. And this is why unaccompanied children and minors are the most vulnerable group. So the third and last phase is that of post-migration. So that is when you've arrived in the destination or host country and comprises those conditions that you have in the host country. For some migrants, often the case for refugees, arriving in a host country has a positive impact on health, at least initially, as you feel safe and you have access to basic necessities. This is, of course, not the case in all countries. But this initial positive impact usually deteriorates with time. The undertaking of an asylum process, for example, is a very long and demanding process, and this leaves many in a period of uncertainty and not knowing what the future will bring. But if granted asylum, future challenges arises in terms of continued legal status or economic prospects, housing conditions, language barriers, etc. And we will continue with this phase and pairing that with the determinants of health and see how migration affects health in the host country. But first, we will look at the migration process from a personal point of view. And this personal point of view is that of Tarek. And Tarek is a 26-year-old man from Homs in Syria. And we will look at part of his migration process. Look at pre-migration. He was living what you would call a somewhat ordinary life with his family, relatives. He went to school, had lots of friends, and he was about to start studying when things changed in his hometown. And bombings became more and more severe. More of his friends and relatives got arrested. One uncle disappeared. His parents, however, didn't want to leave the country, although they knew it was very unsafe staying. And they knew that their sons wouldn't have a future staying in Homs. So Tarek and his older brother made their way to Lebanon, where they got working in construction. And the work they did in Lebanon was under very exploiting conditions. He had an accident at work. Due to this accident, a piece of metal got stuck in his leg. He continued working to be able to earn enough money so he could continue his journey. His brother, however, stayed in Beirut. Tarek found the journey very scary, especially having to cross the water between Turkey and Greece. Once arrived in Greece, he was detained. And in that detention, he was deprived of information, legal assistance, and it was under very poor hygienic conditions. He felt completely powerless, and all he could think about was, how do I get out of here? Tarek finally arrives in Germany, where housing and basic needs are met. He files an asylum application, and that request is granted. His initial time in Germany is quite positive, and he's making progress with the language. However, after some time, he gets depressed. He doesn't have social networks, social support. All his family and relatives are still in Syria. He's moving from one social program to another. And even though he's managed to learn a fair level of German, it's not enough to get into a qualifying profession. Should he do unqualified work, which means that he gets money, but it doesn't mean any further development. He learns that his brother got into a severe car accident in Lebanon and can't support their sister anymore. So Tarek needs to provide financial support. He's also constantly worried about his parents, as he hasn't seen them for 7 years. Tarek is now feeling very stuck, hopeless, depressed, and alone, not finding the motivation to keep looking for a job or trainee program. He also suffers from back pain and sleeping problems. Now I suggest that you take a short break. if you haven't done so already. So if you're sitting down, just stand up or go and get a glass of water or coffee or what you like, but just take a short break. So we've now gone through the migration process by looking at the 3 stages of migration, both as more broadly speaking in terms of different characteristics of these 3 stages, but also with the personal story of Tarek and what part of his migration process looks like. We will again look at the determinants of health, but now looking a bit more at what each level entails. We'll start by looking at this more overarching level, that is general socioeconomic, cultural, and environmental conditions. And this level is made up of different policies and regulations and politics in general, as well as norms and social roles that affect our daily life. So this may be what our social security systems look like, or policies such as labor policies protecting workers' rights, or discrimination policies, or different housing programs, or if there's universal health coverage, specific policies on maternal and child health care. This may also be different regulations and taxation on substance use, such as alcohol or smoking. Now, apart from these policies I've just mentioned, there's also policies affecting migrants specifically, such as migration policies affecting the asylum process, the possibility of being granted asylum, and what conditions are associated with your permit, such as length of your permit or the possibility of family reunification. We also have legislation and regulation concerning healthcare. Depending on your migrant status, maybe only some healthcare may be available. And this differs between different countries, so be sure to look up the conditions in your country. There are also different migration policies in form of different enforcement activities such as detention, deportation, family separation, which obviously impact on health in many ways. But apart from these policies and regulations, this level also entails norms and beliefs that exist in a society. Now, norms are unwritten rules or set of expectations, and norms are not static. They change depending on context and they change over time. Norms guide us on how we act towards one another and are therefore helpful. However, norms are helpful and convenient as long as you conform with them. The use of norms risks leading to discrimination, racism, sexism, homophobia, microaggressions, and more for those breaking the norms. And we know being exposed to things such as discrimination and racism obviously affects our health negatively. And the impact of intolerance in a society, a less tolerant society is, of course, less likely to accept differences and the unknown. Looking at the next level of living and working conditions, we know that these are central to the social determinants of health and have great impact on our health. For example, we know that growing up in favorable socioeconomic circumstances leads to higher levels of educational attainment, which in turn is associated with higher income and better health in later stages of life. As stated before, and cannot be stated enough, migrants are not a homogenic group. Hence, we'll find people with migrant background at all levels of socioeconomic positioning. And this may also have changed as an effect of migration, going from a higher socioeconomic position in your country of origin to a lower socioeconomic position in the host country. And of course, we can see examples of the opposite. When looking at working conditions, we see higher unemployment rates among migrants, and when in employment, there's a tendency of unskilled occupations and a higher risk of being overqualified in relation to occupation. And this is one contributing factor that we can see the average income of migrant workers being lower than that of nationals. Now, housing is not only a physical structure giving us shelter, it's also the place where we can feel safe, have our own space, bring up a family. Hence, where and how we live influence our health greatly. Temporary housing and having to move often, together with living in unsafe neighborhoods, equals negative impact on health. And this is more common for migrants to experience. It's also more common for migrants to live in rented housing compared to privately owned homes for native borns. Also, material resources and standard are generally worse in migrant households. And these are just examples of how our living conditions vary. I mentioned before, access to healthcare varies among migrant populations, and different countries have different health systems. While many international declarations state that the right to health applies to all, including migrants and non-citizens, many national policies exclude these groups, either partially or altogether. Furthermore, your migrant status may affect what type of healthcare you're entitled to. For example, access may differ depending on if you're an asylum seeker, undocumented, or if you have residency. Undocumented migrants being the most vulnerable and having the least amount of access. And they are also likely to delay or not seek healthcare, often due to very low income, either not being able to pay a bill or being afraid of being wrongfully billed, unaware of their rights to health care, or fear of being detected by authorities. There's also linguistic barriers to information and care, as well as different levels of health literacy. And health literacy is the personal characteristics and social resources needed for individuals and communities to access, understand, appraise, and use information and services to make decisions about our health. And with the overload of information and healthcare systems increasingly difficult to navigate, health literacy skills are very much needed. And we see that among different migrants groups, the health literacy skills are very low. So now we've looked at some of the living and working conditions we see for certain migrant groups. We must also confront the fact that the association between socioeconomic factors, migration, and health status are not the same for all. Other factors such as gender, ethnicity, and also impact on the relationship. And research often focus on one or two variables, but being able to see the bigger picture, we need to look at how these factors are interrelated. And this is emphasized in the framework or theory of intersectionality. Moving on to the next level, social and community networks. And this level comprises such things as social inclusion and social support, community engagement, or being part of different associations. As we know that all of these things have a positive impact on health if you're a part of this or have access to this. Human beings are social beings, so we need social connection, we need social relationships. For example, social support has been proven important to gaining and maintaining good physical and mental health. And social support means having family and friends or other important people around you to rely on in times of need or crisis. People who cares about and are concerned about you and how you're doing. As such, social support is a protective factor for health. And having migrated, less of social support is common, as you may have left loved ones behind. Having to leave a context, community, networks, or support system of which you were a part, not to mention probably being separated from your family. Apart from social support, being part of broader social networks is also important, as this could be source of community integration or getting job recommendations or getting new acquaintances. So we know that this level of social and community networks are also vital to our health. Making our way to the next level, that is individual lifestyle factors. And these factors include things such as nutrition, physical activity, substance use, for example, And we know that lifestyle factors are linked to many health problems and diseases, for example, obesity or certain forms of cancer and cardiovascular diseases. And another lifestyle factor is stress. And we all experience stress every now and then, but stress can trigger many physical, emotional, and cognitive reactions, such as sleep disturbance, increased heart rate, sense of helplessness, irritation, or constant worry. And experience high levels of stress or in long periods of time can have more severe health impact in terms of high blood pressure or anxiety and depression. And having experienced migration, you've likely been exposed to many stressful events. Hence, having high levels of stress common among migrants, in particular refugees. We also know that regular physical activity have immediate and long-term impact on health, apart from affecting quality of life. It reduces risk of developing many diseases such as type 2 diabetes or certain form of cancer and cardiovascular diseases, and has an overall positive impact on our well-being. Another example that is that of substance abuse. And in Sweden, we see a higher probability for unaccompanied children and adolescents to seek healthcare for drug use compared to native-born individuals. We also see a difference among foreign-born children, but that have migrated with their parents or other caregiver. We know that unaccompanied minors are likely to have experienced an extremely demanding migration process and faced many challenges in the host country, much more than what's even close to reasonable to have experienced at that young of an age. It's therefore important to keep in mind that all these determinants are part of a complex interplay affecting the individual, and it's therefore wrong to isolate just one factor, one behavior, without considering other impacting conditions and circumstances. So looking at the last level, and that is the core of the model, we see age, sex, and hereditary factors. Now, these factors are non-modifiable. That is, we cannot change them. But we know that they're central to one's health. So we need to be aware of how may these impact health. And we also know that we can do some prevention. That is, activities such as screening can be done to identify and sometimes prevent certain diseases of genetic origin. So to summarize the determinants of health, we know that there are many of them and that we can look at them through different levels and that they interact with each other and in one way or another impact on our health. Say that you are worried about the future as you only got 13 months granted on your asylum request, then you're affected on laws and regulations and different policies in a country. Say that you're worried about being harassed or discriminated against. You're again affected about different policies and regulations, but also norms and level of intolerance in a country. Say that you're worried because you're not having a secure employment or temporary housing and not sure where you're going to live in the next 6 months. Or you don't have your family and friends near, so you lack the social support, and also you're very worried about them because you haven't heard from them in a long time. Then, of course, you're at higher risk of feeling stress. And you may also develop anxiety or depression or other forms of mental illness due to this. As with the case of Tarek, we learned that he had back pain and sleeping problems. But some of these underpinning causes we learned from his migration process. For instance, knowing that he experienced conflict in his home, leaving his family and loved ones, also loss of social support networks, not having a qualified job. So here we see the importance to understand how these different factors interact and the limitation if we isolate a single factor or if we simply reduce a lifestyle factor to individual choice and not acknowledging the impact of the social determinants of health. So we can all agree on that we all want to be healthy and well, but as we understand that we don't have the same conditions or opportunity to do so. We know that the determinants of health are a complex interplay of biological, lifestyle, socioeconomic, societal, and environmental factors, and that migration adds to this equation by both being a consequence of social determinants of health, but also a social determinant of health in its own right. We also know that impact of migration on health depends on many factors. For example, reasons for migration. Is it voluntarily or involuntarily? What are the conditions in which the migration process took place? Most migrants, however, we know, face a combination of legal and social, economic, behavioral, and communication barriers, putting a higher risk on physical, mental, and social well-being. So we need to acknowledge how the determinants of health affect all the patients that we meet, just as we saw in the example in the previous slide. So thank you for listening to this presentation. I hope this has given you some insight in how we can look at the determinants of health and how migration may play a role in this. If you have any questions, don't hesitate to contact me on this email address. Thank you and good luck with the rest of the course.